Welcome everybody. We are going to start our review of lecture of the muscular system and the nervous tissue and brain. Thank you for all of you who are coming for this webinar. And if you have some questions, please just raise your hand. I will open the microphone for you. So far, everybody can hear me and can see me. If there is some issues, just raise your hand. There is an icon here in the menu that you can actually click, and I can see that you're raising your hand, and I will attend as soon as possible. All right, so let's start. Okay, so here we have the two chapters. The main components of this lecture will be the muscular system and the nervous system. Okay, so one thing I want you to remember that is very important to what I want you to know for the next quizzes and exams is the difference between the smooth, striate, and cardiac muscle. So we already talked about this many times. And here, the smooth muscle, what I want you to remember is, let's see, the smooth muscle are especially in the walls, on the walls of the arteries and veins. In addition to that, the smooth muscle is located, for example, in the urinary bladder. In the urinary bladder, we are going to see these two in the gallbladder. We are going to see in the wall of the intestines, intestines. And if you see, I'm going to start talking about the smooth muscle, and if you remember, the smooth muscle is related to the involuntary muscle, right? Involuntary muscle. So this involuntary muscle are going to be part of what we call the autonomic nervous system. Remember? The autonomic nervous system. The autonomic nervous system is going to be divided into somatic, right? Somatic, remember somatic? Let's put a somatic. And somatic is the, is the parasympathetic, parasympathetic, and the sympathetic, correct? Is the parasympathetic the one who releases what? Acetylcholine. The acetylcholine is going to activate the muscles of the fibers of the smooth muscle. The acetylcholine is going to actually be part of the voluntary muscle, that is the striate muscle. So if you remember your what we was talking about, the nervous system is having, let me organize this. The peripheral nervous system, and the peripheral nervous system is going to be the somatic, and the autonomic, correct? Is the autonomic nervous system who is going to actually release what? Acetylcholine. And the somatic is going to release acetylcholine. So this acetylcholine is the one who is going to activate the smooth muscle, striate muscle, and is going to interact with the cardiac muscle. So the muscles basically are going to be associated with the acetylcholine. Okay, acetylcholine. A smooth muscle, we have the gallbladder, wall, intestine, the stomach, the esophagus, the urinary bladder, walls of the arteries and veins. These walls of arteries and veins are the one who is going to relax or contract, so producing the vasodilation or the vasoconstriction. Okay? All right. So that is about the difference between striate muscle and smooth muscle. And you know that the cardiac muscle has similarities to the smooth muscle because they have one nucleus. And similarity with the striate muscle because they have the striate structures. And the striate structures are what? Are actin and the myosin. Okay? All right. So that is a review about this. I start different from the lecture Why? Because you already know what is the nervous system. So that's why I want to integrate this part to the nervous system. All right, so here we have we was talking about the components of the muscle. One thing I want you to remember about the tendon, open eyes, open ears here, please, is that the tendon is the formation of the tendon is from the elongations or projections of the endomysium, perimysium, and the epimysium, right? The endomysium is surrounding this fiber. So here we have a fiber, and surrounding this fiber, we call a membrane called the endomysium. Now, if you have a lot of these fibers, each of them are going to be covered by endomysium. So altogether is called a fascicle. But what about if we cover the fascicle with a membrane, like a plastic bag around, all around? That is called the perimysium. Perimysium. Now we have many perimysiums here, right? Fascicles all over. These fascicles together are going to wrap around with a membrane that is called the epimysium. Okay, so this endomysium is going to make projections. They are going to send projections to the tendon. Each fiber is going to send the endomysium to the tendon. Each fascicle is going to send the perimysium to the tendon. And the epimysium, that is the outer cover of the whole muscle, are going to do the same. So what happened here, that this is going to be a fibrous tissue that is going to connect to the bone. So what is the function of the tendon? The function is to connect the muscles to the bone. Okay, so we have, for example, if you remember the Achilles tendon. Open eyes with this, please, okay? Achilles tendon. Achilles tendon is the tendon that is going to attach the muscles of the calf to the bones of the foot, the Achilles tendon, okay? All right, so let's keep going. So here we have the myofilaments. What I want you to remember is if you have the striate muscle, the muscle here, we have striations here, the striations. What are those striations? These striations are composed by proteins, Which proteins are those? So I'm going to make a close-up and I'm going to see like this. This is the close-up of the striations. So what you see here basically is this is protein called the myosin. And here we have a very thin element that is protein too, that is called the actin. So this is the actin. So basically what you are doing, what you are in the microscope, what we are watching is this structure that is composed by two proteins, the myosin and the actin. Myosin and actin, okay? All right. So for this, we will talk about the neuromuscular junction. Again, and let's see. All right, so let's see. Here we have the neuromuscular junction. So this is, if you see this picture, let me show you here. There you are. In this picture, you have the nerve cell, right? The nerve cell. This nerve cell is coming from the spinal cord, okay? The spinal cord. So this is called the motor neuron, Open eyes, open ears, please. The motor neuron. The motor neuron is the one who is making the activation of the fiber. So there are so many nerves that each fiber, a fiber is equal to say one muscle cell. And each fiber is going to contain this, what we call the neuromuscular junction. So where is the neuromuscular junction? This area. So what is doing the neuromuscular junction? Open eyes, open ears, again, is going to receive the acetylcholine. So that is what is doing the neuromuscular junction. So when the electrical impulse of the nerve is coming all the way, they are going to release they are releasing the acetylcholine. So what is the actually making the release of acetylcholine? The electrical impulse. So electrical impulse is going to release the acetylcholine, and where is going to go the acetylcholine? Are going to arrive to the neuromuscular junction. Neuromuscular junction. Okay. All right, so that is one part of we are talking about the muscle contraction, right? Okay, so if we go here, we already this is a fiber, okay? All this is a fiber. Look at this. I'm going to try to draw this to make it like this. This is a fiber. These are the striations. These are the representation of the striations. So if you remember, the cell is going to have these striations like this. Okay, these striations represent this. This is the actin and the myosin. Can you see the myosin here? This is myosin. Can you see the actin here? Those are the striations that you see in the microscope in the nerve in the muscle cell. Okay, so if all, yeah, I want just to see that all this structure is one fiber. All what I see here inside is a fiber. So that means it's one muscle cell. And this surface, the cell membrane, is this. The cell membrane that I show in here, look at this here, here. This is the cell membrane of the cell, is going to represent this. So all this is going to be the cell membrane, surface cell membrane of the muscle cell. Can you see? Okay, so now here we have the neuromuscular junction. Neuromuscular junction. What is the function of neuromuscular junction? Is to receive the acetylcholine. Can you see these small red dots? Those are the acetylcholine. And the acetylcholine is released by the nerve. So we have now the electrical impulse that is releasing the acetylcholine that is going to go to the neuromuscular junction. And what is happening? What is happening when the acetylcholine get into the neuromuscular junction? They are going to produce the entry of sodium. Sodium is going to enter into, is going to pass here, all the way here, the in the membrane, is going to enter sodium, enter sodium, enter sodium, enter sodium. But here in this area where the sodium is going to go deeper into the cell is this invagination. Can you see this invagination of the cell membrane? So the cell membrane is not going to be straight. This cell membrane is not going to be straight. The cell membrane is going to do in the muscle, is going to do this. And then come back again, and again, and again, and again, until they form the whole cell. So this is called the T-tubules. T-tubules, T-tubules. So the sodium is getting here into the T-tubules, and what happened? We have the area of deposit of calcium inside the cell. This is calcium already here. So sodium is going to make this structure to release calcium from these structures into the cytoplasm. Into the cytoplasm. So all this you see here is the cytoplasm, right, of the cell. So this cytoplasm, when the calcium is arriving or getting out from the sarcoplasmatic reticulum, I don't want you to remember that. I just want you to know that sodium produces the exit of calcium into the, or increase the calcium into the cytoplasm. When this calcium is coming, this they are going to look for this myosin and this actin that are locked. They are actually not working. So what is locking the troponin and the actin is actually another protein, that is this one, and this protein is going to be away because calcium is going to take it away. So calcium is going to release, is going to unlock the actin and the myosin. So again, so let's start again. So here we have the electrical impulse, right? Coming from the motor neuron. Remember that is the motor neuron, and is going to produce the release of acetylcholine. Where they go? They go into the neuromuscular junction. Then they are going to release this process when the neuromuscular junction receives the acetylcholine, that is going to produce the open of doors for the sodium. So sodium starts to get interacting with the cell membrane. So sodium, so electrical impulse, acetylcholine, the sodium is getting all the way through the surface of the membrane. They go into the T-tubules, T-tubules. Sodium is getting here into the T-tubules. And this is going to produce the release of calcium into the cytoplasm, okay? And that is actually the mnemonic I want. I put T, and I didn't mention in class T because T is the troponin. T is the troponin. Troponin is the protein who is locking the actin and the myosin. So calcium is coming, and when they interact with the troponin release, unlock the actin and the myosin. And that is where the contraction will happen, okay? All right, so let's see. We have, again, so the mnemonic that we was looking about was this, right? The giant cat. If you see here in blue, this is the myosin, and what you see in red is the actin, right? So these actin and myosin are locked, but it's going to be released because of the presence of calcium, If you remember the graphic I was showing you in class, this graphic represents what happened in the muscle and in the nerve cell. First of all, this means that when that is what happened in the muscle contraction, this half is going to be muscle contraction, and this is the muscle relaxation. So what does it mean, this graphic? Sodium is going to get into the cell. Remember, everything here is inside the cell. That is what is happening inside the cell. Here is what's happening outside the cell. Sodium is entering into the inside the cell, into the cytoplasm, and enter in huge amounts. So sodium starts to elevate in quantity inside the cell. When they reach the peak, they are going to enter calcium. And this calcium is the one who produces the contraction. So that's what I was telling you, right? So we have the electrical impulse, we have the acetylcholine, sodium is going to enter into the cell, sodium, and they go to the T-tubules, and then they are going to release the calcium, right? Here's the calcium. So sodium first and calcium second. So that is when already is going to happen the muscle contraction. Okay, I hope these are clear. So let me see if I'm going to stop my recording. Okay, so saying that, we are going to mention a few things about the muscles. You know, the mineral that is needed to allow actin and myosin to interact. What is that mineral? So it's the calcium. So calcium is required in order to make the muscle contraction. Again, if you forget that, you can remember this, right? You can remember this. Entry of sodium and then the entry of calcium. Okay? All right, so I see some background noise. I'm going to mute who is doing that. Okay. All right, so here we have the source of energy for the muscles are going to be the glucose, basically, right? The glucose is the main source of the main nutrient that is going to use for a muscle contraction to create ATPs, right? And of course, we have that is through the Krebs cycle. The Krebs cycle, always they need oxygen. So that's why we have oxygen and glucose, okay? Compounds of the muscle cells, we have here the myoglobin. The myoglobin is actually a globulin. A globulin is a protein that is going to be associated with another group producing the myoglobin. See, this myoglobin have the ability to capture oxygen. So it's similar to the hemoglobin, but this myoglobin protein, you know, hemoglobin is a protein too, right? So this myoglobin is present only in the muscle. And what is myoglobin doing is to capture oxygen. Glycogen, you know, glycogen is a polysaccharide, and this polysaccharide can break it down into disaccharides, then into monosaccharides, especially glucose. So glycogen is a source of glucose. And where are basically the glycogen? And glycogen is located in the liver and especially the muscles. That is where is our storage of glycogen. Okay, so you remember the 2 pounds of glycogen, etc., right? Okay, so, and here another thing, very important. This creatinine phosphate. Creatinine phosphate is an enzyme that is a protein, sorry, that is going to be located inside the muscle. This is another protein, okay? So this protein can produce energy in certain circumstances. So what I want you to know is when you have muscle damage or muscular damage, if you destroy the cells of the muscle, let's destroy one cell, the creatinine phosphate is inside. So what happened? The creatinine phosphate is going out, and is going out. The more cells are being damaged, the more creatinine phosphate is going to appear in the blood. Okay? So what is happening? So what is the creatinine phosphate? It's an indicator that you have muscular damage if the lab test is increased. Okay? So an indicator of muscular damage is going to be the creatine phosphate. Where? In blood. So the cells are being destroyed and release the creatine phosphate and put it into the blood. Open eyes, open ears about the creatine phosphate. So please, I suggest you to ask questions yourself about what I remark here in this web. All right, so let's keep going. Okay, so we have the antagonist. That is what I want to remark here, is the antagonist muscles. So for example, you have the upper extremity. The upper extremity is going to be flex, okay, flexion of the upper extremity. This is the head, the person. And here we have another thing that is going to be the extension of the upper extremity, right? Extension of the upper extremity, okay? So when you do the flexion of the upper extremity, this is the biceps, right? Biceps. And under the arm, we have the triceps. So in order to make the extension of the, let's make it a flexion first. If you're going to flex the upper extremity, or you flex the forearm, this is the forearm, are going to flexion of the upper extremity, what you're going to do is to contract the biceps. This is the biceps, what I'm pointing here. This is the biceps. This biceps is going to contract, but posterior to the arm, you're going to see that the triceps, they need to relax, right? So they need to relax because you cannot, opposites cannot contract at the same time. There is no movement. Now, in the extension, you need to relax your biceps and you're going to contract your triceps. So those are what we call antagonist muscles. And that best example that you can tell me is about the biceps and the triceps. Okay, so let's mention about few muscles, and here very important, please. I want you to take notes about this because I will ask or refer few muscles. It's impossible to learn the 510 muscles that we have in our body in a class of 1 hour. So we are going to just remark what are actually more important for this course. We have the orbicularis oculi and the orbicularis oris. we are going to talk about the buccinator. The orbicularis oculi, orbi is like orbit, right? Around the eye, orbicularis oculi. So where is the orbicularis oculi? The orbicularis oculi is the muscles that are surrounding the eye, okay? Elevation of the eyebrow, etc. So those are actually the orbicularis oculi. Then we have the orbicularis oris, the orbicularis oris. Oris means mouth. Oculi means eye. Okay, so we have here the orbicularis oris. Oris is coming from the word oral, right? Okay, orbicularis oris. Then we have another muscle that is the buccinero muscle. Buccinero muscle. And where is the buccinero muscle? The buccinero muscle is this area. So you want to whistle, you are using your buccinero muscle. So when you whistle, the muscle contract, and that it produces the sound of the whistling, right? So that muscle is responsible for that is the buccinero. Okay, so this basically is what we call the facial expression. Facial expression, okay? Part of the facial expression. We have the frontalis, we have the zygomati, we have other things, but I want just you to remember the orbicularis oculi, the orbicularis, oculi here, oculi, orbicularis oris here, oris, oculi, oculi, oris, and here we have the buccinero muscle, the muscle of the whistles, right? Whistle. All right, so then we have the mastication. We have many muscles. We are going to talk about the masseter muscle. This is the masseter muscle. Masseter muscle, remember masseter, mastication. What is mastication? The process of chewing, okay? You're going to chew. That is actually the masseter muscle. Okay, let's keep going. Okay, so here we have the sternocleidomastoid. That is the muscle that is, let me see if I see the sternocleidomastoid somewhere here. Just a moment. Okay, this is the sternocleidomastoid. Sterno, this is a sterno. Why? It's coming from the sternum. One origin is coming from the sternum. The other origin is going to be the clavicle. It's going to be like this, something like that. So here's the sternum, here's the clavicle. Those are the origins of this muscle. And this muscle, sternocleidomastoid. So behind your ear, you see a bone that is part of the occipital bone that is going to go this pathway. So why is this important? This muscle is the responsible for a movement of your head. You rotate the head, you lateralize the head, you said no, for example, when you say no, you're doing your sternocleidomastoid. When you are looking around, like right and left, you are actually using your sternocleidomastoid. When you lean your head over the pillow, you're actually using your sternocleidomastoid. Okay, that is sternocleidomastoid. All right, just to mention here the rotator cuff. The rotator cuff. Rotator cuff is mostly happening in at any age, but especially when people who are doing sport like tennis, like basketball, like lifting a very heavy, weights, they are going to produce the tear of the tendon here. For example, here, here, or here. So this is the posterior or dorsal view of the scapula. This is the scapula. So we have the supraspinatus. You don't need to remember, just to mention that. The supraspinatus, we have the infraspinatus muscles. And look at this, all these muscles from the scapula are going to be attached to the humerus, okay? So rotator cuff, very important. Anteriorly, we have the subscapularis. So we have a group of 4 muscles. Rotator cuff, you cannot, for example, you can not use the soap in your back when you're having a shower. So you put your hand behind you and try to use the soap to try to reach your back, that is producing pain, a lot of pain. That is a sign of rotator cuff. Okay. So what is going to alleviate the pain when you put your arm in front of you and flex the arm? So that is the position that can relieve the pain. So that is the rotator cuff. Another thing I want to remember here is three things. Look at this, trapezius muscle, open eyes, open ears. That is trapezius muscle. I'm going to show you here. This is the trapezius muscle. Can you see the trapezius muscle? This trapezius muscle is the one who is making you climb. That is going to make you climb. You go upstairs in a ladder or something, you're going to climb using the trapezium, right? So you can shrug your shoulders. Shrug your shoulders and say, I don't care, I don't know. That is the trapezius muscle. Okay, that is number one. Number two, I want you to remember the deltoid muscle. Deltoid muscle. What happens if I contract this muscle? If I contract this muscle, I'm going to lateralize my arm. So I'm standing up in this position, and my arms are like this first, and then I'm going to elevate like this my arms. So that means that you're using your deltoid muscle. Contracting this muscle is going to elevate the upper extremity. Number two. Number three, this is very important, the latissimus dorsi. Number three, latissimus dorsi. Latissimus dorsi is the largest muscle on the back, largest muscle on the back, largest muscle on the back, okay? Largest muscle on the back, the latissimus dorsi. Latissimus dorsi, remember, trapezius, deltoid, latissimus dorsi, and another muscle of the trunk that I want you to remember is the pectoralis. Pectoralis. This is the pectoralis major. We have pectoralis minor that is under. This pectoralis major, pecto means what? Pecto means thorax. Thorax, okay? Pecto means thorax. All right, so let's keep moving. All right, so there is a very important muscles that we want to.
Nice. Just ask me what you'd like me to do, and I'll try my best
we need
to
to talk about the respiratory muscles. The respiratory muscles. The respiratory muscles are going to be basically two principles. One is the diaphragm. Can you see the diaphragm here? And second, all these muscles. These muscles are in between the ribs. These muscles are the intercostal muscles. Intercostal. We have two types of internal, external oblique and internal oblique, so that is a different story. But just remember, we have in between the ribs, we have the intercostal muscles. The intercostal muscles are the most important muscle for expiration. Expiration or exhalation is the same, right? Exhale, exhalation is the same. It's the same word. It's the same meaning. So what is this muscle do? What is the doing the intercostal muscles? Is the most important muscle for exhalation or exhalation, right? Meantime, we have the diaphragm, and the diaphragm is going to be the most important muscle for inspiration. Inspiration or inhalation, right? It's the same to say, inhalation or inspiration. All right, so that is the two things that we need to remember about the muscles of the thorax. Okay, so here another thing, we have a big head here. It's an open eyes, open ears, please. Open eyes, open ears. And here we have the external oblique. External oblique basically are muscles that are going to go like this, here, like this. External, go external. Internal oblique are going to be like this, like a crossing. But we don't care about that direction. The only thing I want you to remember is that we have the external oblique, the internal oblique. We have the transversus abdominis. Transversus abdominis. Transversus abdominis is actually behind the the rectus abdominis. That is 1, 2, 3, 4, 5, 6, the 6 packs, right? So behind this, we have the transversus abdominis. So what I want you to remember is this: be familiar with the names of these muscles. Why? Because when I mention the name of this muscle, that means that I'm talking about the muscles of the abdominal wall, abdominal wall, abdominal wall, abdominal wall. Okay? So what are the muscles of the abdominal wall? External, internal, transverse, and rectus abdominis. Now, I want to tell you this. For example, there is people who have a spinal cord accident, a car accident, and they cannot actually go to defecate, so they cannot do stools. So they go to rehabilitation. For example, they cannot pee, they cannot poo. So what they are going to do is to train these people to be able to use these muscles. They are going to learn how to use these muscles to produce compression and push the intestine and push the urinary bladder in order to be able to pee and to defecate. Okay, so these are the abdominal muscles of the abdominal wall. All right, so here we have the perineum. That is the these are the levator and anus. That we have the levator anus. So these are the main muscles here. Elevator anus. We have three elevator anus, the superior, middle, inferior. We don't care about that. So elevator anus, what it's doing is the floor, is the support for all the internal pelvic organs. So that's why we need to remember the levator anus. Here is this area is called the perineum. Perineum. It's called the perineum. Okay, we got it. All right, so okay, so let me see here. All right, so it's actually let me see. All right, so there is one muscle that I want you to remember. This is the muscle I want to remember in the calf. This is the gastrocnemius muscle. Open eyes, very big, please. Open eyes, open ears. So we have here the gastrocnemius muscle. Gastrocnemius nemius muscle. Right, this gastrocnemius muscle is here. So we have, how many gastrocnemius muscles we have? Two gastrocnemius muscles. One here and another here. You touch your calves, all right? So you have a pair of muscles. Those are going to be called the gastrocnemius muscles. Now, if you remember the fibers, the fascicles, and the muscle, and the endomysium, the perimysium, and the epimysium, this is going to, the epimysium, endomysium, and perimysium, they're going to produce or form the tendon. Can you see this tendon? This tendon is called the Achilles tendon. Achilles tendon. Open eyes, open ears, please. Achilles tendon. Achilles tendon. All right, so that is about that. Okay, so here we need to mention a very important name, because you will see a lot in your next courses. Is the Myasthenia Gravis. Myasthenia Gravis. Myasthenia Gravis is an autoimmune disease that is going to block the acetylcholine receptors. Where are the acetylcholine receptors? You know where is the acetylcholine coming from the nerve. But where are the acetylcholine receptors? The receptors of the acetylcholine in the muscle are going to be, very good, in the neuromuscular junction. That is where it's going to be so what is the neuromuscular? I will try to make a draw here. Let's make it like this shape. This is the neuromuscular junction. Neuromuscular junction, neuromuscular junction. And what are these shapes? These shapes are for the acetylcholines that are going to come to activate the neuromuscular junction. So this guy is going to come here, and then it's going to activate the neuromuscular junction, producing the release of sodium. Okay, that is the beginning of the muscle contraction. So what I want to remember, myasthenia gravis, I'm going to write it very, important here, is produce, myasthenia gravis means weaken, weak muscles, weak muscle, weak muscle. Myasthenia gravis, myasthenia gravis, myasthenia gravis. Asthenia means weakening. Myo means weakening of the muscle. So weak muscle, weak muscle. So this myasthenia gravis is important to know because they are going to affect many functions of the life of the person. They cannot even dress up, or they cannot eat, they cannot brush their teeth, or anything at all. The worst situation is that the weakening is going to happen in the diaphragm too, and the intercostal muscles. So the patient need to be intubated. They cannot breathe by himself, but there is treatment for that. Okay, so we will see that later on in pharmacology. Okay. All right, so I'm going to make a small break. We are going to, a small break. I'm going to stop the recording. Just a moment. Okay, let's continue with the presentation today. And the second part of this lecture is going to be about the nervous system, nervous tissue, and the brain. Okay. All right. So here we can we are going to review here what we have about what is the brain. So if you know, remember the brain is going to be divided into we have the cerebrum, we have the cerebellum, and we have the brainstem. Okay, the cerebrum is composed by several lobes, right? Lobes. We are going to have the frontal lobe, we have the parietal lobes, we have the temporal lobes, and we have the occipital lobes. We have a pair of frontal lobe, a pair of parietal, a pair of temporal, and a pair of occipital lobes. But when we are talking about bones, you have a pair of parietal, a pair of temporal, but one frontal and one occipital. Okay? So the frontal, just to review, is basically the motor activity. The motor activity, the consciousness, the intellectual activity, cognitive level. Parietal is the sensorial area. The temporal is going to be the hearing. There is many more. And the occipital is going to be the vision. Okay, perfect. So here we have the cerebrum. So don't forget, cerebrum plus cerebellum plus brainstem, all are going to be part of what we call the brain. Okay? All right, so we have in the outer, let's see what we have here. Okay, so this is the classification that we was talking in the past about the nervous system, right? Nervous system is divided in the central nervous system and the peripheral nervous system. The central nervous system, again, is the brain, and is going to be the spinal cord, right? And the peripheral nervous system will be the voluntary, the involuntary, or autonomic, and the voluntary is going to be the striate muscle. The autonomic is going to divide in sympathetic and parasympathetic. Okay? Okay. So we have the cerebrum. Look at this cerebrum. What I want you to remember, open eyes, open ears, is the longitudinal fissure. Where is the longitudinal fissure? Is in between the two hemispheres of the cerebrum. So this line in the middle here, if I can draw it, that line is going to be the longitudinal fissure. Okay, that divide the right to the left cerebrum. Okay, so we have the diencephalon. The diencephalon is, if you remember, we are going to, let me see if I can draw a brain here in a coronal view. So coronal view, and here we are going to see, we are going to see in the middle of the cat, this cat is going to be the diencephalon. The diencephalon. Important, please. 3 stars, 4 stars here. The diencephalon are going to be composed by gray matter, gray matter, gray matter, the gray matter. The gray matter, the gray matter is is the is the is the structure that is composed the diencephalon. What are the elements of the diencephalon? The thalamus and the hypothalamus. Thalamus and hypothalamus. Okay. All right. So the brainstem and the pons medulla oblongata are going to be basically the center of the cardiovascular center, the respiratory center. So those are the areas where the brainstem is going to work with. Okay. The cerebellum, cerebellum, the cerebellum is for balance and coordination. Balance and coordination. Okay. All right. So now we have the covers of the brain. The covers of the brain are going to be, so can you see here? Oh, by the way, I want to tell you here. This is the gray matter. What you see this line, this is like the skin of the apple of the orange. Remember we was talking about that? These are composed by gray matter. So that's why it's dark. And the gray matter, remember the gray matter, the axons, the nerves are not covered by myelin, not covered by myelin. But here in the white matter, here in the white matter, the white matter, the white matter, the white matter is going to have nerve cells that contain the myelin, 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 myelin. Okay? So now I want you to remember this. What is giving you the white color of the white matter? The myelin. What is giving you the white color of the white matter? The myelin. These myelin cells. That is what is giving the color of the white matter. The myelin. The myelin. Now here we have the gray matter. We have the white matter. This is a piece of the cerebrum. If you see here on the top, they are going to be covered by different layers. This is the skin, that is the scalp. Here we have a periosteum, remember the periosteum? And here we have the bone. Can you see? This is the bone, this yellow with these dark areas. All this is the layer of the bone. So under that, we are going to have 3 layers. This one is the dura mater, the more outer. In the middle, below the dura mater, we have the arachnoid membrane. This is the arachnoid membrane. This is the arachnoid membrane. And below that, close to the brain, okay, so airplane is passing, I guess. Okay, so here we have the pia mater. This is the pia mater, the pia mater. Okay, so now, if you see here, I will try to make it bigger here, just a moment. Okay, I'm going to mute everyone because there is some background noise. Okay. Okay. Let me go back here. Okay. If you see here, we have, this is the dura mater, this is the arachnoid, this is the pia mater. But in between the pia mater and the arachnoid membrane, there is a space. Can you see this space? This space is the subarachnoid space. This is the why it's called subarachnoid space, because it's under the arachnoid membrane. And why is called arachnoid? Arachnoid means a spider. And what does it mean? Can you see these lines here? Imagine the ceiling of your room where you are right now is you look up to the ceiling. That is the arachnoid membrane. Now, wherever the floor is in your house, that is the pia mater. That space between the arachnoid and the pia mater is called the subarachnoid space. And why is called arachnoid? Because from the arachnoid membrane is going to detach some membranes that are going to have the appearance of the spider web. So that's why called the arachnoid membrane. And that is, in this is what fluid is running there? The cerebral spinal fluid, the CSF, the CSF. The CSF is actually fluid that is around the brain. You see here very clear. And what is the function? Now, protection, they have some nutrition, and they are going to release the waste products of the tissue of the brain. So here we have, this is the subarachnoid space. What is running there? The cerebral spinal fluid. Open eyes, open ears. What are the functions of the CSF? Okay, so here we have if they take the brain, if they take, oh, by the way, I was explaining you that these meninges are going to, the meninges are going to cover the whole central nervous system. What is the central nervous system? It's the brain and the spinal cord. Brain and the spinal cord. So the meninges are going to cover the whole thing, the brain and the spinal cord, 3 times. 1, 2, and 3. The outer is the dura mater, the middle is the arachnoid membrane, and the inner, close to the tissue, is going to be the pia mater. Okay? In between the arachnoid and the pia mater, there is fluid that is called the subarachnoid, that is called the CSF, the cerebral spinal fluid. So this is going to be for protection, of course, cushioning from shock. When you have you hit your head, they're going to protect you because that fluid is going to absorb the mechanical forces. So your brain is going to be protected, okay? All right, so let's keep going. So this is the real specimen of how the dura mater is going to be seen. So inflammation of these meninges, meninges are dura mater, arachnoid, and pia mater. Inflammation is called meningitis. So it's too early to talk about signs and symptoms of meningitis, but it's definitely happening with tuberculosis, with any other bacteria. They can happen with fungus. They can happen when it's invaded by viruses. They can lead into meningitis. Okay, meningitis. Okay, so let's go to the pictures here. We have, this is a coronal view. What is this? Somebody can tell me what is this? That is the diencephalon. The seed of the orange, right? So, and what is the components of the diencephalon? The thalamus and the hypothalamus. Thalamus and hypothalamus. So we have here the fibers coming. We was mentioned that the frontal lobe fibers are going to connect with other lobes, temporal, occipital, parietal. They're going to connect with the cerebellum. They're going to connect with the brain stem. So any connection that you can imagine are going to happen. Any connection, whatever connection. So the frontal with the temporal, with the occipital, occipital with the temporal, whatever connection you can imagine, that is going to happen in the brain. So why? Because the different functions of the lobes are going to work together. They are going to work together. Okay, so for example, you want to take a walk, you're walking, so you keep the balance, cerebellum, and the cerebrum need to know what the cerebellum is doing, correct? So the frontal lobe, they need to know what you are listening through the temporal lobe or what you are seeing with the occipital lobe in order to make a conclusion, right? So to know where to go or to not go to go into different direction. So all these lobes are working together. Not only these work together are going to work together too with the cerebellum and with the cerebellum and the brainstem. Okay, so here we have the decussation of the pyramids. So these fibers are going to be called the corticospinal fibers. Why cortico? Cortex. This is the cortex of the cerebrum. Spinal is going to be the spinal cord. One thing I want to tell you to open eyes, open ears again. What is the continuation of the medulla oblongata? Medulla oblongata, as you know, is part of the brainstem, right? Medulla oblongata. This is the medulla oblongata. This is, sorry, the medulla oblongata, sorry, I apologize. The medulla oblongata is this one. This is the pons. This is the pons. This is the medulla oblongata. And this is the midbrain. So what is the continuation of the medulla oblongata? What is going down? The continuation of the medulla oblongata is the spinal cord. The spinal cord. Now, is in the medulla oblongata where the fibers, for example, in this case, is the right lobe, because we are looking from behind. This is the right lobe. The right lobe is going to be all the way down, connecting, giving messages to the spinal nerves, but is in the medulla oblongata where the fibers from one side are going to run towards the other side. So here the same. If we have in this side, the left side is going to go all the way left, 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 left. But when they reach the medulla oblongata, they pass to the opposite side. So that means that if somebody have a stroke in this area, let's put it this area, a stroke is lack of oxygen, you have a thrombus, whatever. So this tissue is dead. So this information supposed to give all this way down are not going to send information at all. So they're going to cross. And that's why if you have a stroke on the right side, your left side is going to be in problems, right? If you have a stroke on the left side of the cerebrum, the right side of your body is the one who going to be in having some dysphasias. All right, so now to review here, we have the gyrus, sulcus. Sulcus is the line in between the gyrus. What are the gyrus? Gyrus are these bulging areas of the gray matter. Can you see? This is the gray matter, right? This is the white matter. Okay. All right, so from frontal lobe, what I want you to remember is the motor area. Motor area. Parietal is the sensory area. You can have here the cognitive function. That is your intelligence, your personality, your taste, etc. Right? So that is the frontal lobe. Parietal lobe is the sensory. Motor area too is what you move your hand, you walk, the action of the movement of your body that is done by the frontal lobe orders, right? All right, so because the frontal lobe have the gray matter, correct? And the frontal lobe is going to send orders to the white matter. The white matter that contains the myelin is going to go deliver the information very fast. To where? They are going to go all the way into the spinal cord, and from the spinal cord go to the peripheral nervous system, reaching your upper and lower extremities. Frontal lobe, okay? Parietal lobe, parietal lobe is the sensory area, so all the what you touch, pain or pleasure are going to be felt in the parietal lobe. Temporal lobe is going to be the auditory area. Auditory area. So remember the temporal. touch your temporal bone, you see you can touch your ears, right? Just too easy to remember. Occipital is the visual, occipital lobe. All right, so here we have another important structure that is called the corpus callosum. Corpus callosum, if listen, if you put your finger through the longitudinal fissure of the brain, remember the longitudinal fissure, you put your finger here in between, you cannot go farther because you're going to stop, but you're going to be stopped by this structure, all this structure. This is the corpus callosum. This is being made by white matter, just myelinated nerve cells. And what it's doing, can you see, it looks like a bridge, right? A bridge from whom? From the one hemisphere to the other hemisphere. It's not enough to know what is doing the frontal lobe from the right side and the occipital lobe to the left or to the right side. It's not the same to have the frontal lobe right knowing what is doing the temporal lobe right. So they need to share information from right to left. So you know what is doing the right cerebrum and what is doing the left cerebrum. So for that, the communication is going to be is going to happen through this structure. The corpus callosum is a white matter that is going to connect. Is going to share information right and left, left and right, right and left and right. And that is what we need to remember, the corpus callosum. All right, so here we have, if you remember the orange, the skin of the orange is going to be the gray matter, or called cortex. The cortex of the orange, right? So gray matter is this thin area. The rest in between all this is the pulp, and that is being made by white matter. But in the center of the orange, you have seeds. These seeds are going to be the diencephalon. Diencephalon. And the diencephalon components will be the thalamus and the, very important, the hypothalamus is the big gossiper, right? The hypothalamus is the one who knows everything. And that's what I'm telling you here. The encephalon is divided into thalamus and hypothalamus. Again, what is being made of the diencephalon, thalamus, hypothalamus? These seeds, the seeds of the orange, are going to be gray matter again, gray matter. So we see here that the cortex or the outer layer, where is the gyrus, the sulci, are going to be formed by gray matter. This like the skin of the orange. The pulp is going to be white matter, and again the seeds are going to be composed by gray matter again. So those gray matter means that give orders. So those are the commanders. Gray matter cells, nerve cells, are going to be commanders, orders, okay, giving orders. And the white matter is the one who transmits the orders, okay? Okay, so let's keep going here. Just to refresh, to remember here, we have what I want from this slide to remember is the brain stem. We have the midbrain, we have the pons, and we have the medulla oblongata. In the medulla oblongata, that is the main thing. So put 3 stars, 4 stars in the medulla oblongata. We have the respiratory center, we have the cardiac center, the vasomotor center, that in other words is the cardiovascular center. Okay, this is like one. And they are going to be, the medulla oblongata is going to produce the crossover. Remember the crossover? The crossover that we was showing here, this is the crossover. So this is the brain stem, this is the midbrain, this is the pons, this is medulla oblongata, and the fibers from one side of the hemisphere of the cerebrum are going to cross over to the other side, and that is happening at the level of the medulla oblongata. And that's what I'm trying to show you here, contralateral opposite side control. So that is in the medulla oblongata where the fibers are going to cross over to the opposite side of the body. Okay, so then we have the cerebellum. Cerebellum is what is going to is called the small brain. Small brain. So it's in relation on close to the occipital bone, right? So this is the cerebellum. Can you see? Small, right? The cerebrum is going to be something like that, huge. So that's why it's called the small cerebrum, but it's or small brain. But definitely is the function of the cerebellum is balance and coordination. Balance and coordination. Balance and coordination. Okay. So you see here that this is the cerebrum. Below that, posteriorly, we have the cerebellum, and anterior to the cerebellum and inferior to the cerebrum, we have the brainstem. This is the midbrain, this is the pons, and this is the medulla oblongata. Okay? Okay, perfect. All right, so here we have another structure that I want just to mention is the vermis. Vermis is the connection between the right and the left hemisphere, any hemisphere of the cerebellum, okay? That is the vermis. All right, I'm not going to talk about that. Okay, so we have the hydrocephaly. This is hydrocephaly. Hydrocephaly means accumulation of CSF, cerebral spinal fluid, where in the brain of the in this kid, right? And that is actually produce distension of the head. Why? Because the bones of the cranium are not fused yet. Okay. All right. So I think I was. Let me stop the recording because I want some questions. Okay, we have the dendrites. Then we have the terminal axon here. This is the terminal axon. Terminal axon, again, terminal axon. And what happened? The electrical impulse is going to be transmitted this way from the axon to the dendrite. Axon to the dendrite in this direction, So then the dendrite go to the whole nerve cell, go from the axon to the next dendrite. Axon to dendrite. That is the way that the electrical impulse is going to be transmitted. We okay with that? So
Yes.
axon to dendrite. Okay. And one thing, when you have this, I mentioned this in class, when you have this nerve cell with the myelin, the Schwann cells, right? So electrical impulse is not going to go in this. It's not going to go in this way, in this manner. It's going to go like this. So that means jumping, right? That is called a saltatory. It's like Italian saltatory impulse, because it's going to jump from one to the next, They don't go this way in this manner. They go jumping. That is the saltatory impulse. What is going to do that is going to speed up the electrical impulse. It's going to speed up the electrical impulse. Okay, we got it? Okay.
Yes.
Please, I want you to remember the cerebrum, all the lobes. I want you to remember all the lobes. I want to remember the function of each of the lobes, right? So we already clear in the previous minutes. What is the corpus callosum?
It's a white matter.
Yes, white matter. And what is doing the corpus callosum?
The bridge for right and left hemisphere.
Right matter.
Excellent. They are going to connect the right and the left. They are going to communicate, share information from the right hemisphere to the left hemisphere, from the left hemisphere to the right hemisphere. Okay? Now, what is the composition of the diencephalon? White matter or gray matter?
It's gray matter.
Gray.
Gray matter. Those are the seeds, right? Remember the seeds? The seeds of the orange?
Yeah.
So that are the diencephalon. What are the components of the diencephalon? It's going to be the thalamus and the hypothalamus.
Hypothalamus.
Okay? Yes, you're right. Then we have, what is the function of the CSF?
Protection as cushion, nutrition, and waste product.
Exactly, very well. Very good. Okay, going to stop the recording.